New guidelines on newborn jaundice. Most newborns at first turn somewhat yellow, usually as a consequence of jaundice. It is not uncommon and works for a short-term period. In very rare circumstances, jaundice can turn into a more serious problem, which is why infants need to be. The baby's yellowish color is due to excessive levels of a substance called bilirubin in the blood. Bilirubin primarily owes itself to red blood cells being broken down. The liver processes bilirubin to make them easier for the body to excrete through the urine and stool. A newborn baby's livers need time to remove bilirubin. Newborns are also more receptive to free radicals, since they have an abundance of unburned reds. These unburned cells do not last as long as more mature cells, which is the reason jaundice is relatively common among doctors and parents should help ensure that new guidelines the request of preventing and identifying jaundice are observed. If any concerns are detected, the baby should be checked. Consider potential risk factors for jaundice, not just the newborn's blood type and gestational age, but also a family history of jaundice, bruises, and the time frame. Use a device to measure bilirubin, if it is 24 to 48 hours of life, or earlier. If a jaundiced look or going home fervent. The most common treatment is phototherapy. The baby is put under a special light, or wrapped in a special blanket with the light inside it, that helps the body get rid of bilirubin. This is safe and effective. When bilirubin levels are extremely high and there is concern for the possibility of brain damage, therapies such as exchange transfusion, where blood is taken out and new blood put back in, are necessary. The process of excretion helps a recovering individual eliminate bilirubin through the blood and urine. Frequent eating is also effective for preventing issues. The baby should hold at least 6 bowel movements over a 24-hour period and should have diarrhea frequently. The seats of the high chair should gradually change from black terry stools to lighter-colored multitasking stools. Before going home, you should understand the necessary aftercare outlined, and get info about jaundice, the bilirubin level of your baby, and other You should pay close attention when you return home to your baby's jaundice. The jaundice will be harder to see in a dark-skinned child's skin. An excellent place to search is a spot where the bones are close together, such as the baby's forehead, nose, chin. If the area is sufficiently stimulated, it takes a few minutes for the blood to flow through the skin and cause the skin to become paler. If it's too rosy instead of pale, this may be an indicator. Because bilirubin levels rise as jaundice progresses from the face downward, doctors be unconcerned about a small infant who is orange in the face and upper chest but has white below the knees more than an infant who is entirely. Get in touch with your treating physician if your infant starts to look bluish, if it has started to spill down below the knee line, and if it is refusing. They arch, twist, or behave in a strange manner as a result of a fever or frequent vomiting. After all, jaundice is fairly typical, and inert serious complications are rare. GOPO may advise you or seek treatment.